So today I'm back with the video of anatomy of the brain structure in a normal MRI brain. Now, I chosen this MRI because there is significant atrophy of the brain so that we can see everything or almost all the structures very clearly. Now, we must know that this is the first ventricle and this is the second ventricle. This is the first ventricle and second ventricle. These are called ventricle where the choroid plexus produces CSF, and these ventricles are all uh, filled with CSF, which acts as a cushion for the brain, which acts to uh, contain all the damages or shocks which the brain gets. So these are the first ventricle and the second ventricles. We call these as lateral ventricles. Now we always know to find out the third ventricle, you must know thalamus, and this is the area of thalamus. So in between the two thalami, you can see the third ventricle. So this is the third ventricle. Apart from that, what you can see, the most commonly used structures in any stroke is the caudate nucleus, the thalamus, and the lentiform nucleus. What we remember it as PTPC. This is the most common site for hypertensive bleed. This is P stands for putamen, which is the most common site of hypertensive bleed. Then is thalamus, then is pons, and then is cerebellum. So these are the four structures which are most commonly affected in hypertensive bleed. Now, to find these structures, it is very easy. We need to find the lateral ventricle. This is the first ventricle, this is the second ventricle. Just beside the ventricle, what we can see, a small almond-shaped structure is this caudate. This is called caudate lobe. You can very easily make out it here as well. So if you simply try to focus on this area, there is this structure which is clear cut demarcated. This is caudate. On the same side, here also you can see this is the structure which is caudate. So this is the caudate, which is a part of basal ganglia. Second thing is putamen. So to find out putamen is a lens stick structure. Lens means it is like triangular shaped structure. So this is type of lens shaped structure. We can very easily make out here. If you focus here, it is here. So this is a lens shaped structure which is called putamen. So this is putamen structure. It is here also you can make it out. So this is putamen structure, which is the most common site for hypertensive bleed or hypertensive diabetic ischemic strokes as well. And exact backside to this large almond-shaped structure is thalamus. So these are the most important structures, especially for bleed or infarct. So in between the thalamus and the putamen, what we have is internal capsule. This structure is called internal capsule. This is anterior limb, this is posterior limb, and this is genu. So this genu has a facial fiber. So involvement of this genu very commonly causes facial muscles involvement or paralysis of facial muscles. Apart from that, what I really wanted to show in this particular MRI is brainstem structure. Now we know this is almost the end of brain. We can see the brain has ended here. So this is the lowest most part of the brain, which is medulla. So this medulla continues as spinal cord. This medulla continues as spinal cord, and this medulla is the origin for ninth, 10th, 11th, and 12th nerve involvement. So if anyone has glossopharyngeal or vagus nerve or um, spinal accessory nerve involvement or the hypoglossal nerve involvement, then the medulla has to be always observed. Just behind the medulla, this transverse, these are called foli. This is very typical of cerebellum. This transverse foli, we call it as foli, or arbor vitae arrangement or arbor vitae arrangement. This is very, very typical of cerebellum. This is all cerebellar structure. Cerebellum is extensively involved, or it is very, very important for balance, coordination, and any muscular movement, the force, the range, and the coordination, this all is decided by the cerebellum. So if anyone has involvement of the cerebellum, very commonly patients present with imbalance, patient present with ataxia. So presence of ataxia, presence of imbalance, presence of dysdiadochokinesia. These are very, very typical features of cerebellar involvement. Horizontal nystagmus is one of the very, very common feature of involvement of cerebellum. So imbalance in coordination, ataxia, dysdiadochokinesia, these are very, very, very typical features of involvement of the cerebellum. So if you want to see whether there is cerebellar involvement or not, what you need to see is the medulla. Just above the medulla, what I very commonly tell is just remember the most circular structure, it will be pons. So this is pons. The most circular structure above the medulla is pons, and above the medulla, the butterfly shaped structure is midbrain. So this is midbrain. This structure is typical of midbrain, and midbrain is the origin of third and fourth cranial nerves, whereas this pons is the origin for fifth, sixth, seventh, and eighth cranial nerves. So this way you can remember that this is pons and this is medulla. This is pons medullary junction, and just behind that, what we have is all cerebellum. These are both cerebellar hemispheres. One of the most important structure in the cerebellum is vermis. Vermis is the central structure of the cerebellum, which is the most important part for balance. So if there is vermis involvement, patients have extensive problem in balance. They cannot maintain balance and they have tendency to sway on one side, whereas the cerebellar hemispheres typically involves one extremity. So if there is left-sided cerebellar involvement, there will be left-sided upper limb or lower limb depending on extent of cerebellum involvement. So the patient will have signs or symptoms of that unilateral or that particular sided upper limb or lower limb involvement, whereas vermis, there will be involvement of balance. So we have seen this caudate, putamen, thalamus. What I wanted to show in this film is there is significant atrophy, and this atrophy is evident by prominence of the sulci and gyri. The sulci and gyri are extensively prominent, which tells that the patient must be having diabetes and the patient must have had multiple small infarcts. That is the reason why the brain is extensively damaged. Now we can see that this is a cerebellum, this is a temporal lobe. How can we say that it is temporal lobe? Very simple. The brain is divided into three foci, that is anterior fossa, middle fossa, and posterior fossa. So this posterior fossa has this cerebellum and the brainstem structure. Just anterior to this posterior fossa is this middle cranial fossa, or we very commonly call it as temporal fossa because the temporal lobe is there, and we can see this area is temporal lobe. So this is temporal lobe, and you can see this temporal horn. This is significantly large here, and here it is very small. Same thing is here. This is temporal horn of the lateral ventricle, which is very small, but here it is extensively large. Compare this here as well. This temporal horn is very small here, but it is extensively large on this side. Means this patient has extensive temporal lobe damage because of the chronic ischemic changes. Here also the temporal horn is very small, but here the temporal horn is extensively large. It means that there is extensive damage of the temporal lobe because of whatever the pathology is there. We can very see crystal clearly see the sulci are so much prominent. The brain should have come to up to this, but no, the sulci are so much prominent. The gyri are also very much prominent because there is extensive damage to the cerebral material or brain material. It means that patient must have had multiple ischemic insults or multiple damages which has caused extensive damage to the brain parenchyma, and compared to that we have this ventriculomegaly. This ventricle should not be that much obvious or that much large, but because of this damage to the brain parenchyma, these ventricles have been enlarged. So I think this This is enough for this talk. We'll again meet, and thank you.